to this episode of the Business of Healthcare podcast. I'm your host, Dr. Britt Berrett of the Center for Healthcare Leadership and Management at the Jindal School here at UT Dallas. Just delighted to have a colleague, a friend, comrade in arms for many decades that we've worked together, visit with us this evening and talk a little bit about the business of healthcare. J.R. Thomas has been iconic in the healthcare space. I've participated in a number of his efforts and his projects, and it's been a delight to watch him lead an organization from virtual construction, the beginning, the inception, to almost a $1 billion business that was recently acquired by a large insurance organization. So, to that end, I'm just delighted to have you with us, and thank you for taking the time. Well, why don't you give the folks a little bit of an overview of your history, your educational background, and what brought you to healthcare?
Well, first of all, thanks for having me. It's a privilege and a pleasure and an honor to be here with you and the work you're doing here at the school. I fell into healthcare probably accidentally. I started out with a pre-med degree, like all mothers who are nurses want their sons to be a doctor, and figured out that a lady having a baby, it probably didn't make sense for me being passed out in the hallway that I should be a physician. So I ended up finishing my degree and going in the banking business, and where I had to learn the flow of money, which was indispensable to me over the years. And after a career in banking, I started financing some emerging healthcare companies, notably MCare, which is based here in Dallas, which was the first emergency room staffing company for physicians, and had the privilege of working with that company, a few more entrepreneurial companies, and then decided in 1996 that I would join 28 physicians here in Dallas and Fort Worth and start a new company called MedSynergies, with sole purpose, which is really lasts over 21 years, is to really improve the administrative operations of a medical practice. And today that's still the case.
That's interesting. So you were way ahead of the curve. You were way ahead of everyone else when you started looking at the ambulatory side and the practice management of physician groups. It's what, $1 billion industry today. What drew you into it? What was the attraction? What did you find intriguing or interesting?
I think first I was in a position in my life to do that. So one, I didn't have any money, but I didn't have any debt. And two, I was young enough to take a risk at a time. I didn't have a family. I wasn't married at the time. I had the ability to really do something and have a fallback to go back in the banking business. So first, I didn't have any, I always had a plan B. Second, I knew that with the consolidation of physicians, that we would have an opportunity to fix and improve the operations of medical groups, because at the end of the day, healthcare starts and ends with a physician group.
Yeah, it's so true.
And so we had to find a way to fix that and improve the operation and improve the patient experience from the past. And that's been a challenge over 21 years.
So the 28 docs just said, hey, let's put together something unique and different. Is that how it was created?
I think that was part of it, the intrigue. But at that time in 1996, we had seen the efforts of the physician practice management companies that have gone public.
Right.
So there was a financial opportunistic initiative that was part of that, but also some of the things around managed care and the things that we're still struggling with today is patient engagement, electronic health records, and the capital costs of running a practice and what is quality. In addition to the revenue cycle was complicated back then as it is today. So there were a few things, but financial and operations and preparation for industry had changed. And fortunately for some of us, it's still that case.
So within virtually a decade, you propelled that organization to a significant player in the DFW and eventually nationally. Okay. So what was the big defining moment of growth? Where did you really take off? When did you know you'd figure this one out and it was going to be successful?
Well, I don't know if I say I could figure it out today, but I would say this. We were able to survive our mistakes, and we had the capitalization to survive mistakes. So that was the first thing. The second thing that really made a difference is we learned what our customer viewed as what was valuable. Not what we thought it was valuable, but what services were valuable to them. And we positioned our company switching from an outsourced business service provider that we can do it better, faster, cheaper, to really became an engine of our customers' initiative. And that was a huge thing for us to understand. So we weren't a customer of a health system. we became their engine for growth, and it became strategic. So in 2009, we closed our first large transaction with Texas Health Resources, which was 66 physicians. We went live in 90 days, and that organization has grown to over 1,000 providers today.
That's an interesting story because that really was big. Unbeknownst to many people behind the scenes, you orchestrated a very significant relationship with the healthcare system. And Texas Health Resources, one of the largest in the Dallas-Fort Worth area, one of the largest faith-based integrated delivery systems in the United States. You joined with them, and then later it exploded to 1,000 plus. Tell us a little bit about how that happened.
Well, first, we had to make sure that we could deliver jointly upon the business they had.
Okay.
So we didn't get too far ahead of our skis. But once we had positive momentum with physicians, that things were not necessarily going to be exactly what they wanted, but they had a way to understand and the why of what we were doing, physicians started looking for a safe harbor. So physicians, Brett, are really an aggregation of patients. And health systems or payers or other physician groups are an aggregation of doctor groups. So at that point in time, and I still think it's the case, is that health systems are going to be here long term in every market. And as a safe haven to join and align with a health system was important, and it is important today. And so then we were able to help them acquire physician groups and employ physician groups to build out their primary care network to really improve their patient market share for Texas Health and Dallas-Fort Worth.
So what was the added value? So in the context of business, what did you bring to these docs? Was it the revenue cycle? Was it the process and system? Was it a marketing? I mean, what was the added value you brought to a single physician or a physician group?
I think there were a number of things. First, it gave a physician comfort that they were with an organization who had the capital, both the health system and MedSynergies, to withstand the changes that their practice would face, that they could not financially withstand on their own. Second, that they would have the technology deployed to them to be able to withstand the rigors of what was occurring in terms of quality, electronic health records, revenue cycle. I think that also the value was it allowed their staff to effectively be trained and ingrained with metrics that they could really understand how they were performing administratively, which was very difficult for physicians, as it really was at the end of the month when the bank account was reconciled. That was their barometer.
You see, I think that's very fascinating because what we have seen is a lot of mom and pop physician practices have been advancing and promoting people just because they're nice or they've worked with them for decades. But when you get into a very complicated healthcare delivery system with a lot of moving parts and managed care and billing and revenue cycle, it outgrows their capacity. And they look around and going, oh my gosh, I need help. That's when you guys all step in and you introduce those business practices.
Business processes, some technology. And the other part, if you think about a physician group today, a primary care doctor will average about $360,000 in revenue a year.
Okay.
Half of that cost is our staff cost. So $180,000 or $150,000 are the non-clinical people costs. And it's like every business, small business, you struggle with the cost of health insurance and the market and how do you train them and how do you recruit and hire. And it really was a difficult challenge for them. So to put some rigor around those processes allowed physician groups to have a better bottom line with less risk.
So you built the company, became very successful, joint ventured with Texas Health Resources. That's when I joined your board of directors. And to be quite honest, I was just enamored with the idea of introducing smart business practices into the management of healthcare. And I think the industry is woefully inadequate in this space. And great physicians are overwhelmed with the complexity of the business side. And, smart business folks like you all can really make that a positive experience and very successful with them. So the THR relationship also allowed you to do what? You had, I guess, critical mass at this point?
It gave us a launching pad, not only just to grow our business, but also build our talent. So one of the things we learned early on was we had to create a culture to know how to hire people and how to invest and train those people so that they could go out and do great things. And so that was also a byproduct of what we were able to do. So it also allowed us to evaluate our human talent of what were their capabilities and capacity. Because the growth rate was so fast, A lot of people received a lot of experience and authority much faster than they probably imagined in most companies. And then it became an example for other companies like Vanguard Health Systems and like Catholic Health Systems out of Inglewood, Colorado, where we did 26 markets in 2 years, and it was almost 1,500 physicians and 8 different systems. So it allowed us to really hone our integration processes, and we continue to learn. It was really a vibrant laboratory.
Successfully grown, organizationally integrated, operationally very efficient. It was clear that someone wanted you to be part of them. Tell us about that.
Well, we had private equity in 2004, and generally you have a maximum of a 10-year window. And in healthcare, there's about a 2-year window to when you sell, and there's about an 8-year window when you buy, and knowing which is what is really important. And I think we're very lucky in terms of our exit in our time frame, and our management team want to have some influence on how that process would occur. Optum, which is a part of United Health Group, is a services company, and they employ 2,000 physicians. And so they were looking for really a platform to really move the practice of medicine as they move forward in other ambulatory type provider groups for their business long term. And so that they came after us.
Real controversial, though, when you think about it, because here's the insurance company with an arm acquiring physician practices and influencing the delivery of care. What was the reaction from the market? Was it people astounded, or they just thought, well, this is the next iteration of healthcare business? Well,
it's funny, when you're from the outside, United Healthcare as an insurer and Optum as a service provider, the market gives them way much more credit about working together cohesively than probably is reality, just like in most businesses that have that. Okay. I can tell you very clearly that there are people who have trepidation. United Healthcare is a phenomenal, great insurance company, and unfortunately, in many cases, it's been a zero-sum game working with health systems and doctors. And I think most of that's is a miscommunication. Mm-hmm. Optum is a service provider, and they're in four out of 5 hospitals in the country providing something to them. And so I think, if you're looking at Optum, or you're looking at IBM, or you're looking at Google, or any big company today, you want to be able to know, 1, what are they doing? And 2, how can they help you? And even if you're not interested in doing business with them, you want to know what they're doing. And so it's been a great experience for our employees, and they've had a great opportunity to really enhance their skills on a much bigger platform. So it's been great.
Almost $1 billion acquisition. I mean, that turned a lot of heads. Let's go a little bit macro on this. Do you think that consolidation and integration is going to continue throughout the healthcare system? Do you think that is the nature of the healthcare system into the future?
I think so. First, we have to drive costs out of the system because the revenue enhancements in this market are going to get very difficult. So if you can't improve revenue, you're going to have to manage it through cost. That requires some technology. Technology is expensive. It has a continuing cost. You're never finished. And so I think we're going to continue to see consolidation. What's really interesting to me is now we have doctors in big groups, and we have them all on one technology platform, and we have one, some sort of a governance committee. We're still woefully behind in terms of population health, in terms of how we can use it to improve health, reduce costs, and improve outcomes. The one part today that's really intriguing to me that I would not have known 10 years ago, I wouldn't even known 5 years ago. There's 2 things that shocked me that we've learned. First, the practice manager who runs that shop or that store is the most important person in our healthcare delivery system today in the ambulatory side. The second piece that we've learned about this crazy business that we're in is that patient market share, seeing the patients you need to see at the right time. And the one part that we have not consolidated is physician schedules. And so I think one of our opportunities, Britt, going forward is how are we going to take access, which is limited? We all know shortage of physicians. How are we going to take the access, which is a schedule with the physician, and optimize it to the needs of the marketplace for their healthcare delivery? That's a great opportunity.
So the integration of technology becomes very, very important in those kind of dynamics, right?
Absolutely.
And certainly a need for capitalization and big dollars to make that occur. Well, I think it's a fascinating story as you've moved from a beginning to, as I mentioned before, almost $1 billion company. And along the way, so let's ask this question. Along the way, You've led a lot of people. You've created a phenomenal workforce, and you've spun off executives into other areas that have been by your side in the past and now are very successful elsewhere. Share with us some leadership tips, some things that you've learned along the way that have been, I think, powerful.
Well, in 21 years of making lots of mistakes, I probably could write a book on hiring. I think, first of all, it starts with you hire the people who their intrinsic character values of integrity, of hard work, accountability, commitment, self-discipline, over skills and intelligence. There are no dumb people today in the school systems. And, smart kids, in my opinion, are a commodity. But people who have heart and gut and who can learn from mistakes and self-discipline. The worst thing you can tell someone is, I'm disappointed in how you handled that. I would tell you today that's really important. The second thing is the role of our human resources departments. Their pattern has gotten broadened over the years. No one wanted to go HR when I started my business career. It was a bad thing. And the word intervention. HR, we pivoted our HR department to serve managers. And great managers at the front line will improve your margin and improve your workforce. And over a 3-year period of time, it improved our EBITDA margin from 18 to 26 to 36% last year. And I attribute that to our managers becoming better financial, business, and human capital people, and our turnover rate dropped dramatically. So the role of HR has, in my opinion, has changed. It's going to a different area. The last thing I would say is if you have an employee that has the right values, you're really slow to fire them. You find a way to take those attributes and put them in place, and it's not a quick knee jerk. Let's get rid of people. And we were known to be slow to fire for certain.
Interesting. To that end, you've got a lot of aspiring healthcare leaders that want to move up in an organization. You've given some suggestions. You mentioned they need to be ambitious with good values, strong values, that you need to invest in human resources, that you need to be very purposeful on the individual and who they are. What would you suggest an aspiring healthcare leader do to demonstrate all those things to you? Suppose, you're the CEO, you've got talent that either wants to join you or is currently working for you. What would you expect them to be doing to demonstrate those elements to you?
Well, the first thing is that they don't have a reliance upon PowerPoint presentations.
Okay.
Unfortunately, PowerPoint presentations are generally, at least I view, to be a crutch for being able to explain your business.
Okay.
The second thing is they can look you in the eye. When they're talking with you, look me in the eye. Tell me what you're doing and why you want to do it. And maybe even tell me what you don't want to do. The last thing I'd say, the most important thing is write me a personal note. Do not send me an email. Take some cheap stationery and scribble out, JR, thank you for meeting with me. It was a great meeting. That's all I need. You'll set yourself apart from 10,000 people today interviewing.
Interesting.
Simple stuff.
Well, you've certainly been successful in your career. We're excited to see where you go in the next couple decades. I will say this, the healthcare delivery system, our healthcare industry is blessed because of your commitment and your leadership. And it's just an honor to be your friend and to watch as you've navigated. I'm excited to see where the next couple decades, where they will take you and where they will take us, because the healthcare challenges that we're facing today probably aren't clinical in nature. We're figuring those things out. It's the leadership and management of the delivery of care where we desperately need great leaders such as yourself. So, JR, thank you for being with us. This is Dr. Britt Berrett with the Jindal School of Management at the University of Texas at Dallas. This is The Business of Healthcare. Thanks for joining us here on the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episodes, notes, links, and more. And be sure to subscribe to the Business of Healthcare podcast on iTunes or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jindal.utdallas.edu and then search under the Centers and Institutes tab on the navigation menu. I'm Dr. Britt Berrett, Director of the Center for Healthcare Leadership and Management, where we're leading change by changing how we